We have patient Laura Taylor, 35-year-old female, presenting with a primary concern of prenatal care visit. This is her second one. HPI includes, she's a G3P0, intrauterine pregnancy at 20 weeks based off LNP, presenting for routine visit. Pregnancy is complicated by advanced maternal age and limited or delayed prenatal care. She denies decreased fetal movement, vaginal bleeding, leaking of fluid, contractions at this time. She notes mild fatigue as she's still working, but denies nausea, vomiting, headache, visual changes, or swelling. Also expresses increased stress and anxiety, rating at 7 out of 10, related to a lack of support from her husband surrounding the pregnancy and future caregiving responsibilities. Current medications is just a prenatal vitamin every day. She is allergic to latex. It causes an itchy rash all over. PMI, 2 episodes of depression, 1 at 18 with excessive alcohol use, and an elective therapeutic abortion at 15 weeks gestation. She was prescribed Prozac and took that for 2 years. 30 years of age, she also experienced another episode with the death of her father. She had a spontaneous abortion at 6 weeks gestation at that time. Past surgical history is just the dilatation curettage for the tab at 18 years old. Family history is mother with diabetes type 2 times 10 years takes metformin. Father's deceased for the last 5 years, died at 60 from a heart attack. Siblings, a brother who is 30 and is healthy. She is college educated. She's a school teacher. She lives in a home with her husband and feels safe there. She was smoking a pack a day before pregnancy for 3 months, but has since quit. She denies using alcohol since she was aware of being pregnant. She was drinking 4 drinks a day, 4 times a week before pregnancy. Denies it being a problem. No substances or marijuana. Safety status, denies any thoughts of harm to self or others. She states she's very overwhelmed and stressed because her husband is, quote, lazy and doesn't help her with anything. He's unemployed and too busy playing video games to care about the baby, end quote. Married for 1 month. Says that her support system is her mother. She denies any history of physical, sexual, or verbal abuse. She verbalizes she is not afraid of her partner. She states all of her immunizations are up to date. Pertinent review of systems includes LNP of 5 months ago. Patient has gained 8 pounds with this pregnancy. She denies seeing spots, tunnels, or sparkles in her vision. She complains of, quote, heartburn times 4 weeks and after large meals and constipation for 2 weeks. She complains of lower back pain that is constant and mild of 2 out of 10. She denies history of STDs or their symptomology. She states she noticed increased tenderness, a clear white discharge or colostrum bilaterally to her breasts. Patient states she is feeling stressed and anxious, 7 out of 10, regarding caregiving, finances, lack of support from her husband, and the expectant baby. She complains of increased anxiety to the point where she's having sleeping and appetite issues. Physical exam findings, vital signs are stable, with a blood pressure of 132/64. So those deep tendon reflexes we want to check, +2 throughout. Her BMI is 21.6, so that's good. Fundus measures 22 centimeters at the navel. We offered resources regarding her stress, and she states she's, quote, willing to try anything to feel better. Diagnostic studies includes an OB ultrasound, an anatomy scan of the fetus to rule out any structural anomalies, AFI, and cervical competence. We want to find out the placenta location and the fetal size. Other labs include a CBC for baseline assessment and pregnancy-induced anemia, possible risk of hemorrhage at delivery. We want to do an RH compatibility, identify that as she's had other pregnancies. And then urine dipstick, because of that blood pressure, rule out protein and make sure she's not at risk for preeclampsia. We're going to screen her for HIV, syphilis, chlamydia, gonorrhea, hepatitis B, and rubella titers. And then we want to do a maternal quad screening and then a nip test, especially because she's AMA. Another diagnostic we're going to use is a GAD7 for anxiety. So our final diagnosis is supervision of high-risk intrauterine pregnancy in the second trimester. Laura's pregnancy is considered high risk because of her age and her delayed care. We also have differential diagnosis of generalized anxiety disorders. She scored a 20 out of 21 on the GAD7 based on those previous complaints. Pregnancy-induced GERD and constipation. This is common symptom of pregnancy, and we will include these into our plan of care. So we have medications that include a prenatal vitamin, one with folic acid and iron every day. We're going to do Tylenol, 650 milligrams, POQ6 for pain 2 to 5 out of 10, Tums, 500 milligrams, 2 tablets, PRN for heartburn, not to exceed 7,500 milligrams. We're also going to encourage exercise, increase fiber, talk therapy, circling birth programs, community resources, and mommy groups. We're going to refer her to LMFT and social work. We're going to do some health promotion, vaccinations based on those labs we drew, and then MMR, Tdap, hepatitis B, flu, RSV. We're going to encourage further prenatal care with cultural considerations and understanding, making her feel welcome and non-judged coming into the provider's office. We're also going to screen her next appointment for gestational diabetes, and then G-based screening around 34 weeks. Education is also going to include signs and symptoms of rupture membranes in early labor, fetal kick counts, and we'll have her follow up in 4 weeks at her OB office for her routine prenatal visit.